Hi, I'm Dr. Alkita Licollari, dermatologist consultant, clinical lead dermatology department, the Princess Alexandra Hospital. In this video, we discuss a real case study about on examination. The female pattern hair loss is classified as grade 3. What causes female pattern hair loss? FPHL has a strong genetic predisposition. The mode of inheritance is polygenic, indicating that there are many genes that contribute to FPHL, and these genes could be inherited from either parent or both. Genetic testing to assess the risk of balding is currently not recommended. This is a follow-up consultation for a patient with female pattern hair loss, metabolic syndrome, and polycystic ovarian syndrome. The patient reports a history of taking metformin some years ago. A previous trial of oral minoxidil from a private provider was undertaken without improvement. She reports experiencing excessive hair loss, estimated at 5 to 6 hairs per day. She also has hirsutism on the chin area, which is being treated with an alexandrite laser. Blood tests were performed today, including a hormone profile, zinc levels, syphilis serology, sex hormone-binding globulin, and luteinizing hormone. How long does it take for FPHL to progress? FPHL can affect women in any age group, but it occurs more commonly after menopause. The hair loss process is not constant and usually occurs in fits and bursts. It is not uncommon to have accelerated phases of hair loss for 3 to 6 months, followed by periods of stability lasting 6 to 18 months. Without medication, it tends to progress in severity over the next few decades of life. What are the effects of female pattern hair loss? Many studies have shown that hair loss is not merely a cosmetic issue, but it also causes significant psychological distress. Compared to unaffected women, those affected have a more negative body image and are less able to cope with daily functioning. Hair loss can be associated with low self-esteem, depression, introversion, and feelings of unattractiveness. It is especially hard to live in a society that places great value on youthful appearance and attractiveness. Should I have any hormone tests done? Blood tests include female and male sex hormone levels as well as thyroid function as part of the diagnostic workup. The majority of women affected by FPHL do not have underlying hormonal abnormalities. However, a few women with FPHL are found to have excessive levels of androgens. These women also tend to suffer from acne, irregular menses, and excessive facial and body hair. These symptoms are characteristic of the polycystic ovarian syndrome, PCOS, although the majority of women with PCOS do not experience hair loss. Less often, congenital adrenal hyperplasia may be responsible. What treatments are available? Treatments are available for FPHL, although there is no cure. It is important to manage expectations when seeking treatment, as the aim is to slow or stop the progression of hair loss rather than to promote hair regrowth. However, some women do experience hair regrowth with treatment. Results are variable, and it is not possible to predict who may or may not benefit from treatment. A Cochrane systematic review published in 2012 concluded that minoxidil solution was effective for FPHL. Minoxidil is available as 2% and 5% solutions. The stronger preparation is more likely to irritate and may cause undesirable hair growth unintentionally on areas other than the scalp. Hormonal treatment, that is, oral medications that block the effects of androgens, for example spironolactone, cyproterone, finasteride and flutamide, is also often tried. A combination of low-dose oral minoxidil, for example 2.5 milligrams daily, and spironolactone 25 milligrams daily has been shown to significantly improve hair growth, reduce shedding, and improve hair density. Once started, treatment needs to continue for at least 6 months before the benefits can be assessed, and it is important not to stop treatment without discussing it with your doctor first. Long-term treatment is usually necessary to sustain the benefits. Cosmetic camouflages include colored hairsprays to cover thinning areas on the scalp, hair bulking fiber powder, and hair wigs. Hair transplantation for FPHL is becoming more popular, although not everyone is suitable for this procedure. Low-level laser therapy is of unproven benefit in pattern balding, but one device has been approved by the FDA for marketing. Platelet-rich plasma injections are also under investigation. Further studies are required to determine the magnitude of the benefit, if